Hi, this is Curtis Alexander. I'm a pharmacist. In this video, I'm going to be covering Fetzima, which is an antidepressant. I'll be covering a whole range of topics, but basically giving you an overview and answering 12 of the most common questions that I get about the medication. And if you want to get off medications, get away from surgeries, I have a free report at my website. Check the link below. So let's hop right into it. All right, so Fetzima, like I said, is used to treat major depressive disorder. There's some people ask, well, will it work for anxiety? It doesn't have an indication for that, not even an off-label indication. So the answer would be no. As far as how it works in the body, it's kind of interesting. You secrete norepinephrine, which is like adrenaline. You secrete serotonin. Fetzima basically goes in and it blocks the reuptake. So the end result is you're going to see norepinephrine go up. You're going to see serotonin levels go up like a lot of the antidepressants do. Interestingly, if you've heard of Savella, it's another medication on the market. It's actually the more active, they call them enantiomers, but it's basically a mirror image chemically of the Savella compound, but it's actually more active, which is kind of interesting. Now, as far as side effects go, the main one we're going to see is nausea at 17%. You can see orthostatic hypotension, so when you go from a seated to a standing position, you can see the blood pressure drop, which is dangerous. People can pass out, fall over. It is dose related, so the higher the dose goes, the more you're going to see this at 6 to 12%. It does have sexual side effects. We can see erectile dysfunction in men at 6 to 10%. Urinary hesitancy, again, this is a dose related one, at 4 to 6%, and you can see an increase in heart rate in 6% of people. People will often ask, can it cause weight gain? There's no evidence at this point that it can cause weight gain, so the answer would be no on that one. As far as taking it with food, it doesn't matter. You can take it with or without food. If it upsets your stomach, the nausea component, yes, you can take it with some food. ETOH, that's alcohol. What about taking it with alcohol? Usually people will say, well, you don't want to drink because, you have depression, and that's true, but it's very much true with Fetzima in the fact that it can actually cause a rapid release of Fetzima in your blood system, and what happens is you can see absorption rapidly increase as well. So it's an interaction. You do not want to drink for sure on Fetzima. Now, there's a black box warning on all these antidepressants about increased risk of suicide, suicidal thoughts, those sorts of things. It's important to point out this is for patients that are 24 and younger. They haven't shown that chance. If you're older than 24 and actually in older adults, they've shown that the risk of suicide and suicidal thoughts goes down. But less than 24, it's a huge risk factor. Okay, now as far as dosing, if you get started on it, they're probably going to start you out at 20 milligrams a day for a couple days, then bump you up to 40. The range for Fetzima runs from 40 milligrams a day to 120. So we'll get you at that low range, see how you do. If they need to bump you up, they will. If you have kidney problems, it's something that we'll need to be careful with the dosing on because your levels can go up, so we want to be careful there. Liver doesn't appear to be an issue. And it does max out at 120 milligrams a day. A great question is, if you start this, how long will it take for it to work? That depends. What I tell people is 1 to 2 weeks, you may notice a difference. But you won't see the full effect for probably 4 to 6 weeks. So keep that in mind. A big problem with Fetzima is the cost. People say, is there a way to decrease the cost? Fetzima does have a financial assistance program. Not everybody qualifies. So it's just one of those things that it really depends on your insurance. Some of them cover it, some don't. So there's maybe some ways around that, but it is an expensive medication. Now, as far as interactions, we already talked about alcohol. That's one to keep in mind. There's another class of drugs that can cause problems. They're called monoamine oxidase inhibitors, MAOIs. If you are on an MAOI and want to go to Fetzima, you have to have what's called a washout period. You need to be off the MAOI for 14 days. Then you can start the Fetzima. If you're moving from Fetzima to an MAOI inhibitor, which would be rare, it's not a popular class of medications, but if you do, you'll want to be off the Fetzima for 7 days and then start the MAOI. Finally, withdrawal is another common question. Can you experience withdrawal? The answer is yes. With all of these medications, if you and your doctor decide it's time to stop it, you need to do that slowly. This is going to vary by person, but generally speaking, it's going to be probably a month to up to 3 months. Just depends on your dose, depends on how you respond. So it is not a quick process of getting off it. So that's something to keep in mind. If you've tried Fetzima, you know somebody who has, please post in the comments, let me know how that went. Did you experience side effects? You know, how did it work? Those sorts of things. It's helpful for me to get your feedback. It's helpful for other people that are watching the video. Speaking of helpful, I hope this video was, and I will see you in the next one. Thank you.